This report analyzes 10 exceptional clinical cases in China where extraordinary anatomical features required cutting-edge medical interventions. These stories illustrate human resilience in the face of rare pathologies and the constant progress of modern reconstructive surgery. Number 10. Lu Hao, the metabolic challenge of early childhood obesity. The case of Lu Hao represents a major clinical challenge in the field of pediatric endocrinology and metabolic management. By the age of 3, this child had a body mass of 60 kilograms, a weight 5 times higher than the growth standards established by health organizations. Unlike classic cases of childhood obesity, often linked to excessive sedentary behavior, Lu Hao's condition was characterized by uncontrollable hyperphagia, an insatiable appetite that far exceeded the body's usual regulatory capacities. Initial medical analyses revealed no obvious hormonal abnormalities, leading experts toward a more complex exploration of genetic and environmental factors. Beyond the immediate cardiovascular and joint risks for the child, this case served as a catalyst for a national debate on modern family structures and the evolution of dietary habits during a period of rapid economic transition. Lu Hao's management required a multidisciplinary approach, combining strict caloric restriction, adapted physical activity, and psychological support, highlighting the complexity of treating obesity when it manifests with such early onset and physiological intensity. Number 9. Bao Shishun, the systemic implications of natural gigantism. Originally from Inner Mongolia, Bao Shishun gained worldwide fame for his exceptional height of 2.36 meters, a physical characteristic that redefined the limits of non-pathological human growth. Although his height was initially attributed to pituitary gigantism, thorough examinations showed constant and proportionate growth, making him a fascinating case study for anthropologists and geneticists. His daily life required total structural adaptation, from the design of custom-made clothing to the arrangement of living spaces capable of accommodating his extraordinary morphology. Professionally, Bao was able to turn this peculiarity into a lever for international notoriety while remaining deeply rooted in his cultural origins. His role was also crucial in animal rescue interventions, where the exceptional length of his limbs allowed him to extract foreign objects from the stomachs of dolphins, proving that his physical attributes could have unexpected practical utility. His life trajectory demonstrates how an individual can navigate the challenges of extreme visibility and the desire for a normal life, while contributing to the scientific understanding of bone growth mechanisms and longevity in very tall individuals. Number 8. Xiaolian, innovation in facial tissue engineering. The surgical intervention undergone by Xiaolian constitutes a revolutionary step in the history of plastic surgery and regenerative medicine. After a severe infection following a road accident destroyed almost all of his nasal cartilage, making traditional grafting methods impossible, surgeons in Fuzhou opted for a technique of autologous tissue expansion in situ. The process consisted of implanting skin expanders under the skin of the patient's forehead, then sculpting a complete nasal structure using cartilage taken from his own ribs. This visionary approach allowed a functional and vascularized nose to be grown directly on the patient's face before its final transplantation to the correct anatomical position. This case perfectly illustrates the incredible plasticity of the human dermis and the ability of modern medicine to grow replacement organs directly on the patient, thereby minimizing the risks of immunological rejection. Xiaolian's story is now cited in surgery textbooks worldwide as an example of technical success in the face of disfiguring facial trauma, opening the way for new reconstruction protocols for victims of severe mutilations. Number 7. Qiaohui Kung, the complex reconstruction of transverse facial clefts. Born with a congenital malformation of extreme rarity, a transverse facial cleft, Qiaohui Kung presented an appearance that was widely publicized as having a double face. Clinically, it was a severe interruption in the development of the facial buds during embryogenesis, resulting in a separation of the soft tissues and bony structures of the jaw and cheeks. This condition imposed major functional challenges, affecting feeding, speech, and respiration, not to mention the devastating psychological impact on the family. Faced with this monumental surgical challenge, a multidisciplinary team developed a treatment plan spanning several years, aimed at suturing the clefts, stabilizing the maxillofacial architecture, and restoring the aesthetics of the face. Thanks to international charitable mobilization, the child was able to benefit from several stages of reconstruction, each aimed at aligning the muscular and cutaneous structures. The success of these interventions represents not only a technical victory for the surgeons, but also offers Xiaohui Kong the possibility of normal social integration. This case highlights the vital importance of prenatal diagnosis and access to specialized care centers capable of treating developmental anomalies as complex and demanding as these on a surgical level. Number 6. The twins with severe hydrocephalus. Between clinical urgency and social perception. In rural areas of China, the case of twins born with massive cranial hypertrophy highlighted disparities in access to healthcare and the challenges of medical education. Presenting a cranial circumference nearly double the normal size at birth, these infants suffered from a severe form of hydrocephalus, characterized by an excessive accumulation of cerebrospinal fluid in the cerebral ventricles. This high intracranial pressure threatened not only their neurological development, but also their short-term survival. While medical authorities attempted to organize an intervention to place internal shunt valves, the case sparked intense cultural fascination, oscillating between stigma and mystical veneration. This situation highlights the striking contrast between clinical reality, a treatable pathology but one requiring immediate neurosurgical expertise, and folkloric interpretations that can delay care. Resolving this case required coordination between social services and pediatric neurosurgery specialists to ensure that the children received the necessary treatment before irreversible brain damage occurred. This serves as a reminder of the need for systematic pediatric surveillance in isolated regions to identify these anomalies from the earliest stages of pregnancy. Number 5. Chen Tuanji. Orthopedic rehabilitation of genu recurvatum. Chen Tuanji lived for 26 years with a disabling orthopedic malformation known as extreme bilateral genu recurvatum, where her knees were inverted, bending backward at a 90-degree angle. This condition, which forced her to move exclusively on all fours, not only limited her physical autonomy but also had a profound impact on her overall growth and spinal health. Her journey towards standing upright was made possible by a series of 7 complex surgical interventions over a 6-month period, aimed at realigning the femurs and tibias, reconstructing the cruciate ligaments, and lengthening the retracted tendons. The rehabilitation process that followed was a test of physical and mental perseverance, requiring thousands of hours of therapy to retrain the brain to coordinate limbs that were now functionally positioned. The final result, allowing Chen to walk upright for the first time in her adult life, constitutes a major medical feat in the field of reconstructive orthopedics. Her story is a powerful testament to the ability of modern surgery to correct old structural malformations, radically transforming the quality of life and future prospects of a patient once thought condemned to permanent disability. Number 4. Liang Shuzhen. The clinical management of giant cutaneous horns. The case of Liang Shuzhen, nicknamed the Unicorn Woman, illustrates an extreme manifestation of a cutaneous horn, a keratotic lesion that, while generally benign, can reach spectacular proportions if left untreated. In her case, a small growth on her scalp transformed over several years into a rigid keratin structure measuring 15 centimeters, causing pain, bleeding, and considerable psychological distress. Medically, a cutaneous horn is often associated with other underlying pathologies, such as actinic keratosis or, more rarely, squamous cell carcinomas, which requires a rigorous biopsy after excision. The surgical intervention to remove this mass required particular attention to preserve the vascularization of the scalp and ensure aesthetic healing. This case highlights the socio-economic barriers that often prevent patients in rural areas from consulting a specialist for initially minor lesions, allowing the pathology to progress to extraordinary stages. The success of Liang Shuzhen's treatment not only resolved the physical health problem, but also restored her human dignity, proving that even the strangest conditions find a solution through contemporary dermatological and surgical expertise. Number 3. Chang Tsuping, facial duplication and parasitic twin syndrome. Chang Tsuping represented one of the rarest cases in the world of fetus in fetu, or parasitic twin, a condition where the embryonic tissues of a twin do not develop completely and become integrated into the body of the other. In his case, this anomaly manifested as the presence of a second rudimentary face on the right side of his head, including a mouth, teeth, and vestigial maxillary structures. This pathology, beyond its striking visual aspect, posed muscle coordination problems, as the movements of his main jaw sometimes caused involuntary contractions in the parasitic twin's tissues. In adulthood, a team of highly qualified surgeons proceeded with the excision of these redundant tissues and a complex facial reconstruction to offer him a more conventional appearance. This operation, risky due to the proximity of facial nerves and shared vascularization, was a resounding success, allowing Chang to emerge from the social isolation to which he had been confined. His case remains a major reference in medical literature on twinning anomalies and maxillofacial surgery techniques aimed at correcting severe congenital tissue duplications. Number 2. Fu Wengui, the structural challenges of a long neck. Fu Wengui, an adolescent from Beijing, was nicknamed Giraffe Boy because of an unusual extension of his neck caused by the presence of 3 extra cervical vertebrae. This rare skeletal anomaly, associated with congenital scoliosis, was not only an aesthetic peculiarity, but a source of chronic pain and serious neurological complications. The nerve compression due to the abnormal structure of his spine severely limited his mobility and his ability to lead a normal adolescent life. Faced with the worsening of his condition, a complex surgical intervention was planned to remove the redundant vertebrae and stabilize his spine. This case highlights the complexity of pediatric spinal surgery and the need for a multidisciplinary approach to treat rare bone malformations. Fu's courage and the support of his family highlight the human dimension behind anatomical anomalies and the hope that modern surgery represents. Number 1. Huang Chunkai, the battle against extreme neurofibromatosis. Considered one of the most severe cases of neurofibromatosis ever documented, Huang Chunkai developed massive facial tumors that completely transformed his appearance, earning him the tragic nickname of China's Elephant Man. These tumors, originating from the nerve sheath, reached a weight and dimension such that they obstructed his basic vital functions, such as vision, eating, and breathing. Despite the weight of the physical burden and inevitable social stigma, Huang showed exceptional psychological strength, choosing to share his story to raise public awareness of this genetic disease. Several large-scale surgical interventions were necessary to reduce the tumor mass and attempt to restore a functional facial structure. His life is a poignant testimony of perseverance in the face of a disfiguring and incurable pathology, reminding us that human dignity remains intact even behind the most extreme physical transformations. Number 11. An unexpected moment. In a small isolated village in Asia, a disturbing image has sowed doubt. It shows 2 children with intense black skin, presented as being born there. Quickly, rumors claimed they came from Africa. Between fascination and skepticism, netizens wonder: simple genetic coincidence, forgotten migration, or manipulated image? In conclusion, these 10 journeys highlight the importance of access to specialized care and surgical innovation. They bear witness to the strength of the human spirit in the face of physical adversity, reminding us that science and empathy remain our best allies.